Welcome back to our podcast, your go-to podcast for simplifying complex medical concepts. I'm Dr. Amin Afraziabi, and today we're diving into a key concept in biostatistics, number needed to treat, or NNT. By the end of this episode, you'll know exactly how to calculate and interpret NNT, avoid common pitfalls, and apply this knowledge to real-world clinical decisions. Let's get started. What is number needed to treat? NNT. NNT represents the number of patients who need to receive a treatment in order to prevent one additional adverse outcome compared to a control or placebo. Think of it as a practical way to measure how effective a treatment is in real-world practice. The lower the NNT, the more effective the treatment. For example, if a new medication reduces heart attack rates and the NNT is 10, that means 10 patients must be treated to prevent one additional heart attack. How is NNT calculated? It's a simple formula. NNT equals sign 1, absolute risk reduction, ARR. Let's break it down. 1. Determine the event rate in the control group, CER. This is the percentage of people experiencing the adverse outcome in the placebo or standard treatment group. 2. Determine the event rate in the treatment group, EER. This is the percentage of people experiencing the adverse outcome while receiving the intervention. 3. Find the absolute risk reduction, ARR, OARR equal sign, CRER4. Calculate NNT, ONNT equal sign, 1, ARR example. Calculation. Imagine a study testing a new drug for stroke prevention. Control group, no treatment. 20% of patients had a stroke. Treatment group, 10% of patients had a stroke. Step-by-step calculation 1. CER equal sign 20%, 0.20. 2. EER equal sign 10%, 0.10. 3. ARR equal sign 20%, 10% equal sign 10%, 0.10. 4. NNT equal sign 1/0. 10 equal sign 10. So 10 patients need to be treated to prevent one additional stroke. Common mistakes in interpreting NNT. Even though the math is simple, misinterpretations are common. Let's go over key mistakes. Mistake hash 1. Ignoring the time frame. NNT is always tied to a specific time period used in the study. If a trial follows patients for 3 years, then the NNT applies to that duration. Example, if a cholesterol-lowering drug has an NNT of 50 over 10 years, you can't assume it prevents heart attacks in just 1 year. Mistake hash 2. Confusing NNT with relative risk reduction, RRR. NNT is based on absolute risk reduction, ARR, not relative risk reduction. Many studies report relative risk reduction, RRR, because it looks more impressive, but ARR and NNT give the true clinical impact. Example, if a drug reduces the risk of a disease from 2% to 1%, the relative risk reduction is 50%. But the absolute risk reduction is only 1%, 0.02, 0.01, meaning the NNT is 100, 1/0.01. Mistake hash 3, not identifying the comparison group. NNT always compares two groups, usually treatment versus placebo or new treatment versus standard treatment. Example, if NNT is 20 compared to placebo, that doesn't mean the treatment is better than all alternatives. It only tells you how it performs compared to placebo. Mistake hash 4. Thinking a lower NNT is always better. A lower NNT generally means a treatment is more effective, but context matters. Example, if a chemotherapy drug has an NNT of 5 but causes severe side effects, is it worth it? Sometimes a treatment with a slightly higher NNT but fewer side effects is preferable. Mistake hash 5. Ignoring baseline risk. NNT depends on how common the disease is in the study population. If you apply an NNT from a high-risk population to a low-risk one, it may overestimate the benefit. Example, if a vaccine has an NNT of 50 in high-risk elderly patients, it may have an NNT of 500 in young, healthy individuals. Key takeaways. NNT tells us how many people must be treated to prevent one adverse event. Lower NNT means higher treatment effectiveness. Always consider time frame, comparison group, and absolute versus relative risk reduction. A low NNT is great, but side effects and patient population matter too. Final thoughts. NNT is a powerful way to evaluate treatments in real-world settings, and understanding it well will help you interpret clinical trials, answer exam questions correctly, and apply evidence-based medicine in practice. If you enjoyed today's episode, don't forget to subscribe to Master USMLE and leave a review. Stay tuned for more high-yield biostatistics and clinical pearls in our next episode.